Hi, I'm Dr. Rachel from MetropolitanMD. Today we're going to talk to a patient who's concerned about the appearance of his eyes.
For over probably 10 years now, people have been noticing or saying to me, you look really tired. In pictures, my eyes seem to be baggy and saggy. And I'm tired of trying to figure out how I can open my eyes more when I take a picture or look more awake. So I thought I need to do something, and so I'm here to find out what I can do to make it better.
Okay, great. We've already had a chance to take a look at the pictures that we took earlier, and so let's go ahead and examine you now.
Perfect.
Overall, I'm looking at healthy skin, healthy eyelashes and eyebrows. The position of the eyebrow here, we're looking at that. I look at whether or not the eyebrows have fallen to some degree. A lot of times what happens over time is the outside part of the eyebrow tends to fall, and that can create a little bit of hooding out here. Sometimes in the inner part, it can bunch up a little bit. And so an eyebrow lift is sometimes indicated. It's more common in females, but it certainly can be done in males. Sometimes we do a chemical brow lift, sometimes a surgical brow lift. For the upper eyes, what I'm looking at is the excess skin in this area here and a little bit of fullness in here. So if you close your eyes and I can pinch this excess skin, that's a fair amount of excess skin that you have here. With your eyes closed, you have a really nicely well-developed eyelid skin crease, and that's where an incision for the upper eyelid blepharoplasty goes. If you open your eyes, and I can pull the lower eyelid skin down and pull it out, it snaps right back like a healthy eyelid should. When I look at the fullness of the lower eyelid, that's fat that is herniating out and kind of falling out, that creates that fullness. And that fat, there's an inner, a middle, and an outer on the lower, and some inner ones on the upper eyelid. And so for lower eyelid surgery, commonly we'll go ahead and tighten the muscles in the skin and go ahead and take away some of that fat. The area out here, this is the crow's feet. So if you give me a big smile, and that creates some lines out there, and that's crow's feet. So we'll talk about some of the different things that can be done in order to help rejuvenate the eyes, either surgically or with injections.
Perfect.
Okay, Jake, we're going to go ahead and put some marks on you now in preparation to go ahead and do the upper eyelid surgery.
Great.
Before we get started, do you have any questions for me?
How long will it take?
Probably going to take about an hour or so. First, we're going to put some marks on you. Then we're going to give you a little medicine to kind of relax you. Then we'll take you back to the procedure room, get you numbed up, give that a few minutes, and then we'll go ahead and get started. Each eye takes 20 to 30 minutes, and then we'll be done. Okay, let's turn your head towards me. Like I said, you have a little lateral hooding of that outside tail of the brow here. So because of that, I'm going to do this back cut where we actually extend the incision in the skin crease up and back. And that's going to help pick up some of that lateral hooding that we have. And that's from the dropping of the eyebrow. The frontalis muscle is a muscle that comes up to allow you to raise your forehead, but that ends kind of right in this area here. So that's why this tail of the brow tends to fall more. And so if you did a brow lift, we'd actually pick that up. Since we're not doing a brow lift, we want to take a little bit of that excess skin and remove that. Okay, so here we completed the markings. Again, we have the lower eyelid skin crease and then the amount of excess skin. And it's relatively even on each side as we go ahead and remove it. So go ahead and close your eyes. And so if I were to squeeze this skin and pinch it, he still can comfortably keep his eyes closed. Does that feel pretty comfortable, Jake?
Mm-hmm.
Doesn't feel like you're straining to try to keep the eyes open?
Not at all.
Okay, good. Let's do the same thing on this side. So that amount of skin, it's a decent amount of skin. You can definitely keep your eyes closed, even if we take that much skin. I feel comfortable on that side?
Mm-hmm.
Okay, good. Excellent. Go ahead and open your eyes. And go ahead and look up. So there, you can see the skin crease as it comes up and over, just removing that excess skin. And when we're done, you're going to be able to see that nice little shelf, and the eyes will look great. Awesome. So now we're going to go ahead and give you some medicine to relax you, take you back to the procedure room and numb you up.
Tequila?
Tequila it is.
Is it 6-0 or? This is 6-0, yeah. So.
I mean, seriously, it's like I've had facials that had been more uncomfortable than what we're doing.
Oh, wow. Your eyes are closed. We're all done with that right side. Go ahead and open your eyes. And then look up. And then close again. There you go. So, your eyes feel comfortable?
Uh-huh.
Excellent. So, now we're going to go ahead and get started on the other side. One more layer, then we'll be all done. Okay, surgery went great. How do you feel, Jake?
I feel good.
You just got done.
Just a little numb around the eyes, but everything else is great.
How's your vision?
I think I can see you better now.
Right.
I don't even have my glasses on.
Excellent. So this was the excess skin that you had. We made the incisions across here, and now you can actually see the eyelid creases. So a lot of that skin was hanging down, making the eyelids kind of heavy. So not surprised that you feel like you can see a little bit better. So
Wow.
congratulations. Hope you enjoy it.
Thank you so much.
All right,
It's
great.
great.